I have a huge amount of sympathy for the motivation behind Medicare for All. I mean, we have a system that is just failing on so many levels. I mean, lower life expectancy 3 years in a row, extraordinary epidemic of obesity and overweight, gun violence, so many important issues where we are just failing in awful ways. And Medicare for All is probably one of the pieces that would more change the trajectory of our system. But then I get down to the raw politics of it. You have to get it through Congress. There's no way in the next 10 years, a single Republican senator or House member would vote for this. So you need at least 60 Democratic votes to get this done. If the Democrats have a glorious, successful next November, they will, against the odds, have a Senate with 51 or 52 Democratic votes at best. So it's a nice conversation, and it's going nowhere. I mean, there's no short-term future for it at all, unless you can tell me. I mean, how does this have a snowball's chance in hell, Adam?
So you're making the case. You're making the case for that this is not a politically feasible concept. And I think if you look at history, every major significant reform felt infeasible until it was achieved. I mean, civil rights certainly felt not like a feasible, a prospect of winning before it was achieved. Gay rights. I mean, the fall of the Berlin Wall. We could go on and on. I think that, yes, I fully agree that there's major political obstacles to achieving something this big. But again, there's been many reforms that have been achieved in history and that have surmounted obstacles of this nature.